Today, pharmacists are known as the medication management experts of the healthcare team. They collaborate with patients, their families, and other healthcare providers to improve patient outcomes and maintain the continuity of care. The traditional role of pharmacists is expanding. They deliver a wide range of healthcare services such as medication reviews, minor ailment management, drug therapy monitoring, patient counseling, and immunization services. In most provinces, pharmacists are authorized to prescribe with varying degrees of authority, a service that complements the physician patient care. Pharmacists are an integral component of the interdisciplinary primary care teams that constitute the current framework of Canadian healthcare system. With extending scope of practice, pharmacists are often faced with barriers for seamless delivery of their services. Out of these, majority comprise of system-level factors. There is a dire need for improved technical infrastructure and interoperability between pharmacies and other healthcare providers. Lack of digital integration with uncoordinated health informatics and dearth of comprehensive shared electronic medical records often leave pharmacists without adequate information about the patient to provide these services with confidence.
Linking technology to healthcare has made the healthcare a lot easier, not only for the healthcare staff like the doctors, physicians, nurses, but even for the patients. The primary reason is that it saves a lot of time, as the data, including the demographic information, the financial information, the insurance information, etc., is directly uploaded onto the electronic health records. So these electronic health records can be accessed by each and every one who is involved in the circle of care of the patient. These include the doctors, nurses, the pharmacists, and so the doctor that prescribes the medications earlier used to go to the nurses, and thereafter the nurse would take it to the pharmacist, which would take a couple of days to get the medication from the doctor to the pharmacist. This caused a lot of amount of time to be wasted. However, using the electronic health records, the pharmacists can get the prescriptions directly emailed or logged into the system by the doctor itself. So the pharmacy can dispense the drugs directly to the patient upon arrival. It also helps the pharmacies to keep a tab on the drug abuse. There are many potentially dangerous drugs such as morphine, codeine, which are highly abused by the patients in general, can be kept under control. Moreover, the data that is gathered from the pharmaceutical registries or the clinical data networks can be exchanged with the public health authorities, and therefore they can help and therefore they can understand the data. It also helps them in deciding the isolation and the social distancing protocols. The technology used by the pharmacies can help them in building a good reputation in the market, because many of the medications are pretty expensive. It even allows the patients to get their drugs sitting in their homes by using the telemedicine feature, as most of the apps are linked to their phones, and they can easily order their medications upon uploading the prescription.
Okay, so when moving toward implications and the next steps in pharmacare, there are a few technology-based tools and practices that can be implemented when aiming toward quality care and services. So to start, there are currently very few technological tools that exist with pharmacists. However, with the usage of clinical decision support tools, this can help pharmacists perform their clinical responsibilities, such as evaluating patients or performing medication reconciliation and working up on patients, as they typically go back and forth between sources in the EHR to get the most up-to-date information. So knowledge-based CDS tools also utilize subjective and objective clinical data from the EHR records. Having access to EHR data helps healthcare workers, such as pharmacists, recognize changes within a patient's medical history that further provides assistance with making connections on a patient's past and present medical history. The CDS system takes all clinical and patient data from an EHR record into account when making decisions. A common use of CDS tools or function is the alert feature that works to recognize and alert providers the potential risks and adverse drug interactions. This can also be viewed through the medical reconciliation aspect that we mentioned earlier. CDS tools also help establish accurate clinical diagnoses, screenings for diseases, and it also assesses effective and up-to-date treatment options. Okay, so computerized provider order entries, or also known as the CPOE programs, work to decrease medical errors. This helps pharmacists with real-time legible patient information and medical orders. So this increases the level of productivity among pharmacists by allowing workers more time to focus on clinical duties beyond their order entry or verification tasks. E-prescribing can reduce transcription and legibility errors. CPOE systems have also decreased the overall likelihood of medical errors by 48%, and it has also been estimated that the use of e-prescribing has averted approximately 17.4 million errors in a given year.
Hi, the following are the steps on how the healthcare practitioner should focus on managing technology with respect to electronic health record. The first one is electronic prescribing. COVID-19 resulted in a shift in prescribing habits. In-person consultations were no longer possible, and many prescribers lacked access to fax machines, which are commonly used to send prescriptions. The importance of an electronic prescribing system was underlined by the combination. The need for an effective EHR system with electronic prescribing functionality so pharmacists can receive prescriptions has been demonstrated by COVID-19. The pharmacist must also have access to a system that can interpret the electronic prescription for this system to work. The second one is improved EHR. COVID-19 has accelerated the use of digital technology, making them indispensable to the majority of healthcare professionals. It is critical for pharmacists to have a thorough understanding and skill set in electronic health record. Within their skill-based courses, universities with pharmacy schools must offer a robust EHR curriculum. This will lead to a high level of EHR in EHR technology and electronic prescriptions. It will also aid students in their preparation for both their experimental learning, training, and practice. Some clinical decision support systems based on EHR data have been developed to assist pharmacists, particularly in the area of antibiotic stewardship and ADA identification. However, there are still many areas where they can be improved. With community pharmacists being the primary point of contact for patients, the patient data collected can be utilized by public health departments for critical policy making, intervention planning, public health surveillance, and reporting systems. Enhancing existing data interchange standards, HIEs, and interface along with the engagement of HPOs will ensure that the needs for public health department are met.